Good afternoon, one and all. Let's see about the epidemic, endemic, and pandemic. We have gone through the pandemic in the 2020 and 21, 2022 also. Still, you are facing of COVID-19. So it is closed all our international borders, our trade, and everything. So let's see about the what is the definitions of epidemic, pandemic, and endemic. Epidemic describes the an unexpected increase in the number of disease cases in a specific geographic area. So what does epidemic stand for? It stands for a only specific geographical area. But when we go into the pandemic, what you have seen, it starts as epidemic and it gone through the pandemic. We have seen that China, it started as an epidemic, COVID-19, but it increased to the level of pandemic when it was transferred to the across international borders. That's we call as pandemic according to WHO. And we see the endemic, a disease outbreak is an endemic when it is consistently present in particular region. Like we have seen in India, we go through the malaria, the polio, these are the diseases we can see as endemic. But in pandemic, we have seen COVID-19, HIV virus, all we can say as pandemic. But in epidemic, we can see as polio and flu. These are the things we can term as epidemics. But as an endemic, we can say malaria confined to one area in India, and polio is also confined to one area, and chikungunya, all these diseases can be treated in endemic. Let's go through the next slide. Let's see about the monkeypox. Monkeypox, we can see all there in the news recently. WHO has given an alert to all the government leaders and alerted all the people from government functionaries to be alert about public health emergency of international concern. It has given a term PHEIC. What does PHEIC stands for? Public health emergency of international concern. Like everyone have to have concern because it is crossing all the borders from one place to another. It is transferring from internationally from one country to another country. It has started from Africa, Central Africa, and it was gone to Congo, and it came to West Asia and Asia and USA. It is spreading all the way. So it has opened the international borders. So WHO has initiated all the government functionaries to be alert about it. Let's see the definition what they have given, like an extraordinary event which is determined to constitute a public health risk. What the WHO is saying, it is the public health risk across the states, not confined to one state. So it has given an alert, health risk is going to be happen. So all the public functionaries must be alert on these things. International spread of disease and potentially require a coordinated international response. What did it say? It wants us to be coordinated because no one state can deal individually, because it is going through all the borders from one country to another country, another country to another country. So all the alerts must be given to all the public functionaries to be alerted about it. Like PHIC, you have a quote also, a serious, sudden, unusual, unexpected, which carries implications for public health beyond the affected states. Like as I said, it is crossing all the national borders. It is not confining to only one state. It's not only confining to India. It's not only confining to Africa. It is confining to not only confining to Congo or Brazil or USA or China. It is transferring from all the countries from one place to another. So we must be alert. It's going to be a public health risk. We have seen COVID-19. We have lost so many of lives. So the WHO has alerted all the governments throughout the world to be alert. And let's go to the next slide. See what is the pathogen that is causing the monkeypox virus. The monkeypox virus is a double-stranded DNA virus. What it is, it's a double-stranded DNA virus. We can see virus has two types of DNAs. Like one, it is called DNA, the nucleic material. The other one is RNA. The virus is made up of nuclear material, one is DNA and the other is RNA. But when we see this monkeypox, it's an enveloped and it's a double-stranded DNA. What does it belong to? It's belong to a orthopoxvirus genus. Orthopoxvirus genus. We can see we already know about smallpox, chickenpox. The same family it belongs. So we can see poxy, the poxy, smallpoxy, chickenpoxy. Then the genus it belongs to orthopoxvirus, and the family it belongs to is Poxyviridae family. Okay, there are two distinct clades, the monkeypox virus, the Central African Congo Basin and the West African. As I said, it has started from African countries. You can see there is first thing in Central African clade, a group of organisms, and West African clade, a group, clade could be called as a group of organisms. Let's go to the next slide. Okay, what is a monkeypox? What do you term a monkey? You identify it's an animal. It's a zoonotic, okay? It's a viral zoonotic disease because it is coming from an animal. It can be termed as viral zoonotic virus that occurs primarily in tropical rainforest. Where does Africa belong to? Does it belong to Central Africa? Where does it belong to? Are there rainforests there? Go through your geography, you can find out. Go through your atlas, you can see where these African countries are there. So it is actually there. Then it is exported to other regions. It is confined only to these places, the Central and West African countries, but now it got exported to other regions. Okay, monkeypox is transmitted to humans through close contact with an infected person or animal. The animal must have already affected with the virus, or the person has contact with the animal, so with the material contaminated virus. Okay, how could a human get this virus? Virus material which is contaminated by the secretions of the animal or any fluids from the animal may lead to contamination, like the water, the trees, the branches. So the human may contact those places and he may get the virus which is there in the animal. Monkeypox is transmitted from one person to another person through the physical contact of lesions. When it affected the human, from where we get this one, lesions from the body fluids like blood, semen, and the respiratory droplets and contaminated material such as bedding. Okay, when the person is hospitalized, we use the beds, or infected person is there, he uses the bedding. So from that source also we are going to get this infection. So what did WHO said? Be alert. It wants to be alarmers. So we may get from the lesions of the infected person or body fluids such as sweat, blood, plasma, or anything, from the respiratory droplets also. You know, we all have used our N94 masks, still we are continuing to using those masks. Be healthy from all the respiratory droplets of other contaminated people in the COVID-19. Likewise, we have to be alert for this also. Let's see the definition of the virus. What does the virus mean? It's a submicroscopic infectious agent consisting of nucleic acid. I already told you nucleic acids. What are the nucleic acids present in a virus? It may be a DNA or RNA. It is surrounded by a protein coat. It can't be left like that. So it is coated. It's there in a protein coat body. It's a submicroscopic. No microscopic can see the virus. It is submicroscopic. Its sub means it can't be visible through the microscope. A virus cannot replicate alone. It can't. If you left a virus here, it can replicate itself? No, it can't. It needs a host. It must infect cells and use components of the host cell. The virus, if you want to be replicated, it must be infect the cell. A human body or animal body, it must infect the cells. It must use the components of that host cell and make copies itself. Often The virus, what do it do? Kill the host cells. What do virus do to our body? Kills our body, it suppresses our immune system, it causes damage to the host organism. If it got infected to a human, his cells will get infected and it will kill the cells in the human body. If it get affected to animal, it will kill the cells in the animal body and cause infection and its immunity get decreased. Well-known examples of virus causing human diseases include, we all know HIV AIDS. It has only treatment, but eventually by immune suppression the patient will die. We have seen COVID-19 because of immune suppression and respiratory issues, other issues, people have died. And we also seen about measles and smallpox. These are all virus causing diseases. Let's go to the next slide. How does the virus cause diseases? So as I told, cell tropism. For let's see, if a virus want to attack a body, it needs a host, isn't it? It needs an animal or human. So cell tropism, what does it mean? Which type of cell the virus can infect? Presence of appropriate receptor on the cell surface. It needs a receptor to get into it and it will get into the body and the virus must attempt to get into the cell. Virus enter the body. How does virus enter into human body? Through inhalation. Like I am taking a breath now, I may take the virus if it is the droplets are there here. Okay, by ingestion. Okay, the host cell may ingestion. Okay, sexually, like HIV we see, HIV is transmitted to sexually, and parental and inoculation through the skin of mucous membranes. Through birth you may get the virus, okay, from mother to fetus. So why did this WHO alerted us? It is not so small as we think. Monkeypox, it may transfer. It may also transfer from mother to fetus. So all the pregnant women must be alert. All the people want to be alert. So through inhalation it may spread to us. So we all want to be alerted. We all know the incubation period is there for viruses. It must be attached to the human body cells. Then the incubation period might be less than 7 days, and is disseminate the incubation and tends to longer. Virus specific antibody rises during the course of infection. What does it happen? We all have immune system, T3, T4 cells. What does it do? When I get an infection, my body cells will fight against the pathogen, isn't it? We have an immune system with us. Likewise, the immune system, we have course of infection. Specific antibodies play important role in preventing reinfection. If I got a smallpox or chickenpox in the early ages, now there are antibodies in my body. It causes not to re-get the same disease for me. My defensive mechanism in the body will work against the pathogen. Certain viruses are able to evade immune response and establish persistent infection. There are some infections like HIV, we can't suppress it, isn't it? We only can take medicine. Their immune system will get decreased, but it will cause persistent infections in the body of that human. Let's see the next slide. How can we diagnose the virus? There are two techniques we can see. That's ELISA technique and PCR, polymerase chain reaction, where we did polymerase chain reaction to detect the viral load in patient sample and to know which type of enzyme linked or protein based test this is to find out the disease. Let's see the transmission. Give me a second. Let's see the transmission. How it's going to happen. You know the meaning of transmission, right? Animal to human. I already told you it is called transferring from animal to human. So it is called zoonotic transmission. It can occur from direct contact with the blood. If there is a monkey, the stable animal, no, it jumps all around. It may lose its blood. It may touch with a traveler or woodpecker from a forest, from the body fluids, cutaneous mucosal lesions. It is from human to human transmission of infected animals. There is evidence of monkeypox virus infection has been found in many animals, including rope squirrels, tree squirrels, gamian pouches, dormice, and different special monkeys and others. See, in the ecosystem, in the nature, all will live in a forest. There may be transmission from one to other because of they share the food, they share the hunting food and the water. It may transmit it, okay? Eating inadequately cooked meat and other animal products infected animals is possible risk factor. WHO also alerted us to be eating inadequately cooked meat. Okay, we must follow some procedure for the cooking process. Okay, otherwise we may get the disease. The people living in or near the forested areas and may have indirect or low level exposure to the infected animals. Did you got that? Forest dwellers, tribals, or the people who live on the forest product may get a chances are there mostly who dwells with the forest areas. Okay, and there are some and people who treat with the animals and feed the animals who works in the forest departments may get disease because of they gone to contact with these animals or that environment. Let's go to the next slide. As I told you, human to human transmission happen when we got close contact with the respiratory secretions of, if I get an infection through the my respiration, the other people might get. Okay, so we should use the mask again from the skin lesions, like is there a rupture in my skin or any other body parts of any other, we may get from the blood from there, it might get infected the person. We may use the containers like vessels or any other, we may get infection through that. Transmission via droplet respiratory particles. Why did we use masks and COVID-19? Because it is droplet respiratory particles which might infect us. Okay, the same cases now we may get zoonotic disease because of the droplet respiratory particles might infect us, which we put health workers, household members, and other close contacts of active cases at great risk. Who are the COVID warriors? Who had gone to first, like treating them, or those called COVID warriors. Like that, the health officials or health workers might get infected because they will be the first contact persons with the infected persons, or the household members because those household members will know firstly reacting with the members of those family who got infected. Transmission can also occur via the placenta from mother to fetus. This is a big alert. So all the pregnant women must be alert because of that one. Okay, which can lead to congenital monkeypox during close contact during and after birth. If a mother got during the pregnancy, the child may get because of through the fetus. Okay, or after delivery, if she got the disease, the kid may get that one. Okay, there is an unclear, still we have no evidences of that if it is going to transmit through sexual transmission or not. We are not clear so far. No data has been given. Let's see the signs and symptoms of the monkeypox virus. The incubation period, monkeypox virus usually is 16 to 13 days, but it could range from 5 to 21 days. What are the signs are there? We can see fever, intense headache, and we have lymph nodes swollen. It is a major thing we can see here. And we have back pain also, lymphadenopathy. The swelling of the lymph nodes is a distinctive feature of monkeypox compared to other diseases. Okay, we have lymph nodes here behind our ear. We can see by touch, we can find out here, we can find out our lymph nodes. If our immune system is suppressed, our lymph nodes will get swollen. Alert, okay? Always we have to find out are our lymph nodes are swollen or not. So we need to go for a test. We might be. So alert the people. The skin eruption usually begins within 1 to 3 days of appearance of fever. What are the symptoms? And we have seen the symptoms. Now we're going to see the signs. What are going to happen? It are very alert we have to have. See this one. The appearance of rash. We can find out the rash here. Okay, in the trunk region or in the face region, in the palms, we can see it may be erupted. The rash evolves sequentially from macules and to papules, okay, the vesicles, and it crusts, which dry up and fall off. The number of lesions varies from few several thousands. In several cases, lesions can be coalescent in large sections of slog off. You can see because of these wounds, our skin may slog off. That's very dangerous. We have to be so alert with this one. We shouldn't take it very easily. The treatments on vaccine, there is no specific treatment or vaccine available right now. Usually before that, we used to take a smallpox vaccine that could be treated this one. But now it is going to be public health alert of international concern. We need to be see what other medications are going to be there. But the world was declared free of smallpox in vaccine. It was used that time. The smallpox vaccine was used to treat the poxy family of viruses. So there is no specific treatment right now. We are going to treat with them the same medication what we used in the smallpox treatment. So what is WHO told to the all government leaders or government heads? Improved surveillance and response, raise awareness of the disease, and avoid contact with the wild animals, especially monkeys. What it told to the government heads? They want to surveillance the people like international travelers or forest dwellers or forest direct contact people must be surveillanced. Okay, like we have used in COVID-19. And we have to activate our response team and we have to alert all the people. And the second one is all the animals that might have come in contact with the infected animal should be quarantined. Like the human quarantine we have seen in 2020 because of COVID-19. So the infected animals should be quarantined. Okay, handle with standard precautions and observe for monkeypox symptoms for 30 days. See this period. Okay, we have to be alert for 30 days, not 3 or 1 week or 10 days. We have to be quarantined for 30 days. Okay, we have to be watch out very much alert about it. It's a human important refocus of attention on other disease. People are not seeking healthcare, public facilities owing to COVID-19 restrictions. We have seen COVID-19 because of what the lockdowns, people are not going to hospitals recently because if they get any infection, they are worried about the quarantine measures. They're worried about the isolation procedure. They're thinking that the government will isolate them and it leads to difficulties for them. Okay, so what the WHO told, government must be alert the people and government functionaries and must activate the medical personnel, medical facilities on war footing. It's not going, it have to be take measures very war footingly to address the issue. Okay, this is about PHEIC. Okay, public health emergency of international control of monkeypox. There ends the monkeypox lesson. Thank you.